Hello there! I am so glad to have you joining me on this continuation of our review of different body systems. So far during this course, we have talked about the blood and cardiovascular system. Remember, these were the transportation media and the transportation system for many vital substances that we need in order to live. Then we had a bit of a look of the lymphatic and immune systems. These were all to do as the complementary drainage system for the blood vasculature, and then of course all about body defenses against pathogens. And we remember that there was a link between these systems. Now, on this lecture, there is once again another link between the systems. So our focus will be on the respiratory system. And how it relates so closely with what we have seen so far is of course the fact that we gain oxygen via lungs. It gets transported to the different parts of the systemic circulation bound in blood. And then the blood carries carbon dioxide in it to the lungs where it is eliminated from the body. So there really is a whole set of complementary functions and interactions here. So we will be focusing on the respiratory system. And this system is very important. In fact, one of the first and essential steps that we check in a patient. So airways, for whether there is an open path for the air to pass into and from lungs. This is important. Then breathing, again, we want to see the patient breathing. So we might look, listen, and feel whether this is happening. And of course, if the patient is not breathing and is non-responsive and no independent heartbeat, we move our attention to maintaining circulation through making chest compressions. Recently, however, the American Heart Association changed the recommended order in most cases of cardiac arrest to CAB. I think that it is always a good idea to take a step backwards and go to the basics. So we will start by considering why do we need oxygen and why do we need to get rid of carbon dioxide? Sounds like a really fundamental question for understanding the respiratory system, doesn't it? And we go back all the way to our introductory bio course and the concept of cellular respiration. Remember, we got energy from diet in its simplest form as sugars. And then we converted that on a cell level into energy in form of ATP. But this process required oxygen, and as a byproduct or waste if you wish, we ended up producing also carbon dioxide and water. So if we want to summarize, the main function of the respiratory system is to ensure sufficient oxygen supply to the body, where cellular respiration will then take place, and disposal of carbon dioxide, which is the waste product of cellular respiration. There are some other functions such as sensation of the smell and speech production, which we can look at later. And if you look at how the respiratory system is going to do this, we look at a few different steps that must be completed. Getting air in, distributing it, collecting what needs to be put out, and exerting it from the body. And to achieve this, we have all these structures. And respiratory system organs can be divided as if they belong either to upper or lower respiratory system. This is, in my view, a little artificial cutoff, but since your textbook uses it, we will use too. Let's review these one by one, following the path of the air in the respiratory system. And we will start with the nasal cavity. And the external nose is the only external portion of the respiratory system. Behind it, we will see nasal cavity. One thing that I do want to note at this point is that typically we mainly breathe through our nose. The mouth is recruited to assist usually only when the amount of air acquired through nose is not enough. Think about it. Yawning is typically our body's response to the low oxygen levels, an attempt to quickly get in more oxygen by recruiting only mouth to this function. So this is a way why yawning may seem to spread in a room, while in reality the room air is likely low in oxygen. Same goes for the running and when we may start to breathe through our mouth during it, to get more air and more oxygen and to get rid of more carbon dioxide quickly. So, let's start our discussion by looking at the most anterior part of the nasal cavity. Yes, the nostrils. We may know these as nares as well. Interestingly, while it is commonly used, also for the singular in the medical field, the correct Latin term would be naris. One thing that you might notice is that the nostril typically has some hair right at the opening. Some have more, some less. Why would we have it there? Yes, to filter large particles from the air that we breathe in. We will also notice that the inside surfaces of the nasal cavity are lined with mucous membrane. This is an epithelial tissue type which is thinner than the skin, highly vascular, and characterized by the mucus. This is wet, sticky lining of the nasal cavity, and it makes this space humid and traps any particles that may have escaped the filtering by nose hair. And it is goblet cells, like here, that secrete this sticky mucus. Another thing to note is, especially on this microscope image, is these hair-like structures on the surface of the nasal cavity mucous membrane. These cilia sweep mucus that has caught particles towards the throat. And interestingly, within the nasal mucosa, there are also a lot of nerve endings that can trigger sneezing to force particles out from the nasal cavity. The next set of structures that I want us to have a look of are the nasal conchae. These are mucosa-covered projections from the wall of the nasal cavity. They extend from the lateral walls towards the mid-space. And there are 3 of these on each side: superior, middle, and inferior conchae. So why would we then have these structures protruding from the lateral wall of the nasal cavity? And yes, first of all, this way we are able to have a larger surface area to the nasal cavity mucous septum, so more area for the particles to get trapped to. Another interesting thing that by having these structures, it breaks the flow of air, generating something called turbulence. This is the circulating flow of air in a horizontal direction, like a tornado that has been flipped on its side. So this allows as much of the air as possible to come into a direct contact with the nasal mucous membrane. What other structures do we see? Well, this same picture will help us with the next one too. Nasal septum forms the mid-sagittal line separating the nasal cavity into left and right space. This is made of cartilage at the anterior portions and more posterior by the parts of the bones from vomer and ethmoid bones. I do want to mention, however, that it would be very rare that the nasal septum is as straight and making the left and right side of the nasal cavity as symmetrical as shown on these images. In most of us, it is fairly irregular, as shown on a little indication on this MRI with a coronal section of the nasal cavity and rest of the head. I should also mention that the floor of the nasal cavity is formed by the hard and soft palate. So the hard palate is more anterior due to the bony structures inside it. I have shown this with green arrows on this picture. and soft palatal posteriorly with just soft tissue inside it, shown with yellow arrows. And at the very back, we have the uvula hanging down at the back of the mouth. Final structure, or a set of structures that I want us to focus on this region, are the paranasal sinuses. Remember from our anatomical language that sinus was a sac or cavity within an organ or tissue, so an empty space if you wish. And paranasal sinuses are therefore cavities in the dense portion of the cranial bones near the nose region. Let's have a look at these. And these are named based on the bones of the skull where they are located. There are 4 that I want to introduce to you. Just note that to visualize their location, I provide 2 views. One from the front and one from the side, because they are located in such a 3-dimensional space that you need to use those to visualize their actual location. So the first one that we will have a look of is frontal sinus. These are located on both sides within the frontal bones of the skull. Then we have our maxillary sinus within the maxillary bones, again on both sides. Sphenoid sinus is a single sinus within the sphenoid bone further back and more inside the skull. And finally, what I prefer to describe as ethmoid labyrinth, although some call it ethmoid sinuses. I use this term because really it is a network of connected smaller sinuses within the ethmoid bone, appearing more like an interconnected labyrinth. So there we have our 4 types of sinuses. I guess that we still have one important question to answer regarding these. Why do we have paranasal sinuses? And that is a good question to which we do not have a definite answer. Your textbook lists some, and I will add to that a little, mainly because a colleague of mine spent his PhD studying these sinuses and their function. Well, the first that we all are on the field seem to agree is that they help to reduce the weight of the skull. If the skull was solid bone, it would be much heavier, so these gaps help to take away some of the weight from the skull. Then, another one that is becoming a better accepted possible explanation is that these sinuses play a role in the voice resonance. There has been some interesting research on these, and it does have an effect to our voice. The third one is probably a bit more controversial. It has been described that the sinuses, these empty spaces in the bony structures of the face region, especially function a little like cars' front in a collision. The cars are designed so that the front does collapse, and by doing this they absorb the impact of the collision, not putting all of it on the driver and passengers. So it has been hypothesized that the sinuses could play a similar role if a person were to hit a surface face first. It is up to you whether you are fully convinced. And finally, more research is starting to suggest that these spaces may have a role working with the immune system too. I am still waiting to see a little more evidence, but this is an interesting hypothesis. And it gives us a nice bridge to move on to one clinical condition that I do want to introduce. Sinusitis is an inflammation of paranasal sinuses. Remember, in medical terminology, itis was always an inflammation of some kind. And in this case, it is an inflammation of the sinus. And we have here also a very nice CT image of the patient's left maxillary sinus being inflamed and full of material. I want us to return to this figure just briefly, because we can see here, as indicated by the arrows that I placed, an opening of the auditory meatus, so a connection from the ear to the back of the nasal cavity. So this is why sometimes when your ears might get blocked during a plane climbing or descending, or even in a car if there is a significant elevation change, this is why swallowing or opening your mouth might help. It is no coincidence that back in the day they started to give mints or other hard candy for the passengers on a plane just before taking off or landing. The final thing regarding this region that we should talk about is the function of a nasal cavity at large. And there are three essential things that this mucous membrane-lined route for the air to enter into our respiratory system does. Let's discuss those. Firstly, the sticky mucus-lined surface works as a great way of catching any particles that may have gotten in through the hair at the nostril. So it is all about filtering the air before it gets further into the body. Secondly, there is a rich blood supply close to the surface of the lining. And remember, this was thinner lining than the skin. So this allows us to bring a lot of heat into this nasal cavity. And this heats up the air. Have you ever taken a deep breath of a cold air through mouth? You might have noticed that it makes you cough. So we want the air that enters the respiratory system to be similar warmth to the body temperature. And thirdly, continuing with our example of breathing in through mouth on a cold winter day, the air can also be very dry, which makes us cough too. So the humid and moist environment within the nasal cavity ensures that we moisten the air before it enters into the body. So those are the three essential functions of the nasal cavity. And that concludes our review of the first section of the respiratory system. I will see you in the next video.